Anthony's here, and he's our next speaker, our final speaker, and then I'll close this session after he talks. But I'm particularly thrilled that Anthony Hardie's our next speaker. I don't know anyone on the screen that wouldn't know him, but I'll do the best introduction I know how, which is that I don't know anyone that's worked harder on behalf of veterans with Gulf War illness, and you all have worked so hard. But Anthony took a very special skill set when he joined the fray early on and helped develop an effective system to lobby on behalf of Gulf War vets, a highly effective system. I have been with other groups lobbying that just showed up with all their yellow T-shirts and started throwing flyers around. But Anthony actually had worked behind the scenes and knew how it worked and organized a highly effective way to develop what eventually became the Gulf War Illness Program, funded by the CDRMP, which is congressionally directed monies. And if you will look at the CDRMP's achievements, you'll see clinical trial after clinical trial after clinical trial, which is extraordinary as we have pressed hard on long to try to move science into trial. And this is in large part because not only did Anthony and his colleagues work hard to get the money, they also volunteered to be on the advisory boards that helped the DoD determine its research priorities. And Anthony himself chaired the advisory board that helps determine the annual focus of the year's funding. So I probably should have had a better background of where you were born and raised and all that, but I wanted to say what you actually achieved. Hey, Anthony, are you about ready to start? So I just mentioned before that you're one of my personal heroes for using your amazing skill set to organize advocates in a highly effective way to develop a well-funded and organized base, and participated at the leadership level enough that those that were in a position to develop the program announcements actually heard and responded to the needs of the veterans and pushed very, very hard to move the basic science findings into clinical trials. Highly successfully, the trials, of course, now well-funded and moving. So we invited you to talk from your perspective of having done that, how that worked, and is it possible to keep that going, keep that energy going in some way? How do we reinvigorate the field during these times of weird, we don't know what's happening next funding? I'd love to hear your opinion about that.
Great. Well, thank you so very much. I really appreciate it. And thanks for holding the conference today. And, I'm reminded, of course, that today, February 24th, it's of course, a symbolic day for many of us. On this day, obviously 34 years ago, the Gulf War Coalition on this day launched the ground campaign to successfully liberate Kuwait from Iraqi occupation. But what many of us Gulf War troops didn't know is that the liberation of Kuwait and the end of combat operations would not mark the end of our overarching Gulf War experiences, but really only the beginning, with the onset of a lifetime of debilitating chronic health issues that's now known, of course, as Gulf War illness, which we've been focused on in this wonderful conference today. I'm grateful to you, my friend and colleague, and someone I deeply respect and admire, Dr. Nancy Klimas, for inviting me today to give this short presentation for the Gulf War illness community that describes a little of the, and very briefly, the efforts of advocacy to successfully create resources that resulted in the knowledge we have in hand and the trials that are underway, that helped to set up a momentum that led to the Honoring Our Pact Act. And in short, essentially where we are, where we were, where we are, and where we need to go. Where we were was a very dark place. Deep governmental denial, gaslighting of Gulf War veterans' lived experiences, suffering from what they experienced in the Gulf War and came and brought home with them, declining health. For roughly 1/3 of us, U.S. Gulf War veterans who served in the Gulf War, and across the entire coalition of Gulf War troops, including the French and all the others, who served in the coalition as well. And while some of our specific symptoms varied, many of us, of course, experienced debilitating fatigue and respiratory symptoms that wouldn't go away, and devastating gastrointestinal symptoms, and growing concerns with cognitive impact and pain and skin issues, and some with headaches and more. And today marks 34 years. Not just of um, success at the beginning of the successful liberation of Kuwait, but 34 years of health issues. Most of us weren't even 34 years old when this began. For me, I got involved relatively early in the Gulf War advocacy movement. In 1995, it was just shortly after the fledgling grassroots Gulf War advocacy organizations had just coalesced to form a new national Gulf War advocacy organization. I got involved with and soon found myself to be rising to be a national leader amongst my valued but very similarly afflicted peers. Quite a number of them are now passed. Are now deceased. Together, we battled the Pentagon's logical but inherently flawed three no's, as we called them at that time. There was no presence of chemical warfare agents in theater, therefore there was no possible exposure, and therefore there was no possibility of anyone being ill. The three no's: no presence, no exposure, or no use, and therefore no illness. Yet we were ill, and as time would show, there was a veritable toxic soup of toxic exposures to which we were exposed, and we now know as the likely cause of our persistent adverse health outcomes, which have persisted for 34 years and counting. And so we organized and we advocated and we learned and we grew. And at first we were ignored. And then, as the saying goes, we were ridiculed and then countered and dismissed, but still we advocated with our members of Congress and the federal government, with the news media, with our fellow veterans and service organizations. And as time passed, it became clear, at least to me, that answers, and a few of us, that answers to our health issues required new medical research to connect our toxic exposures to better understand their causes, a term that I came to learn later, etiology, and to better understand what was going on in our bodies, terms that I came to learn later, the pathobiology or the pathophysiology. Over time, it became clear that the answers weren't just policymaking or funding or political, but they were rooted in science, in medical research, to help to uncover biomarkers not just of exposure or exposure effect, but also of current illness. And so our small but deeply committed movement advanced that effort in the realm of science and science policy and medical research, and where all of those things met. In turn, that eventually showed the need for helping to move the federal colossus to create and fund a new federal research arm. We learned several lessons along the way as we helped to create this new federal research arm, which became known as the Gulf War Illness Research Program, or the GWIRP, within the Department of Defense's Congressionally Directed Medical Research Program. It began by advocates for breast cancer a couple of decades ago. And those advocates pushed for funding because the existing federal funding arms were not, federal research pots of money were not successful in doing what breast cancer advocates really needed, and the sense of urgency that these advocates brought to bear as well. Over time, this became known as the Congressionally Directed Medical Research Program, and today it's the second largest federal funding pot of money for second largest federal pot of money for medical research, second only to the NIH, larger even than VA, at over $1.5 billion for a dizzying array of health conditions. And what they all have in common is that they're powered by advocates who, like me and others, push for the urgency of finding treatments and things that are going to improve the health and lives of those affected, and helping to marry up researchers and clinicians and policymakers and those who are creating federal pots of money to make all of this happen and to continue all of that funding, and then ensuring that that the research is moving in the directions that patients need most of all. Sometimes, it can get very distant. And so we learned a lot of lessons along the way, developing personal relationships with key legislators in Congress, since these are federal issues, including the House and Senate Committees on Veterans Affairs. But that's not enough, since much of this is outside of VA, and the Veterans Affairs Committees only oversee VA. So also the committees on armed services that oversee the Department of Defense, but in particular, the appropriations subcommittees, and especially the Defense Appropriations Subcommittee. That's pretty rarefied air in Congress. And so we got to know other health advocacy organizations as well. And so developing uh, successful coalitions with other like-minded organizations. So the Multiple Sclerosis National Society for Multiple Sclerosis, and for Alzheimer's research, and for ALS, and dozens of other health advocacy organizations. And together they in turn formed a coalition called the Defense Health Research Consortium, or the DHRC. And the DHRC is still very, very active in doing what it is doing. In advocating, and it advocates just for the larger, in helping to carve out a space in federal funding for ensuring the continued success and continued funding for the congressionally directed medical research programs. The DHRC doesn't advocate for any one single program, but each of its individual members certainly do all of that and then work together. But it's also about developing those relationships. So meeting with literally every member of the Defense Appropriations Subcommittee every year. Ensuring that all efforts remain fully bipartisan, not tolerating any dissent into partisan politics. And never forgetting that today's minority party is tomorrow's majority, and vice versa. And that continues to flip, repeatedly throughout American history. So maintaining those relationships on both sides of the aisle, maintaining relationships year round, not just when you need something, maintaining them throughout the 2-year Congress and the 1-year appropriation cycle. Again, not just when you need something, developing relationships so that people know who you are. When you walk in the office, they know who you are. Providing updates on research findings throughout the year. Just a short little email saying, I think you might be interested. Developing those relationships, not just with the members, but with the key staff. Those staff, when the members choose to move on, the senator or the representative decides to move on from Congress and retire, or they move up, or they move on to other things. Those staff, they often stay on Capitol Hill for a long time, or they rotate back out to an advocacy organization that might be helpful as well. So developing those relationships is just critical. Showing the value added and successful outcomes throughout the year. And then when it comes time for funding, having a 1-page or a 2-page paper showing here's what's changed since last year. Here's what research studies have been funded. Here's what the outcomes are. Here's what publications are successful, maybe providing some numbers and some statistics, but overall, never losing that patient perspective. What are we doing today to advance those outcomes to improve the health and lives of those suffering from the condition. Another point was that we learned, introducing our key researchers, the PhDs, the MDs, and those who happen to have both of those degrees, to their own members of Congress, also to key leaders. We've got some wonderful photos that I'm thinking of with some of the people that are here today: Dr. Klimas, Dr. Kim Sullivan, Dr. Lee Steele, Dr. Fiona Crawford, and others who are, speaking right on the, walking up to the members as getting into where they're speaking. They're coming off of the floor of the House from a key vote and coming out to meet with us for 5 minutes or 10 minutes and bending their ear, and, MD to MD speaking to this particular congressional leader who was a medical doctor himself. But all further relationship building. And they don't, they remember people and stories. So that's another key point as well. And sharing those individual stories, working with other veterans organizations to ensure strength in numbers as well. Every year we did an advocacy letter with all of the veteran service organizations signed on, or as many as what we could get in support of the funding. Having somebody like me in the background, for 16 years, having someone that's going to help to corral the efforts and ensure that there's consistency of messaging across all of these different forums, from the research side of things before the National Academy of Sciences to before the CDMRP itself, to the policymaking entities, before the VA, before DoD, veteran service organizations. Sometimes you have to scale the message up or down for your audience. Always having very helpful to have the researchers and MDs presenting to congressional staff as well, in those well-attended congressional briefings, to provide updates, not just when it's time when you need something, but here's an update here's an update on where this money is going, that you're helping, through all of your efforts in Congress, the members of Congress, what you're doing to help to fund these as well. So those are just a few of the key lessons that we've learned as well. Unfortunately, during the recent pandemic, one of the casualties was our hard-won Gulf War Illness Research Program within DoD CDMRP, which served the Gulf War illness scientific community for 16 years in a quest for treatments to improve the health and lives of Gulf War veterans with Gulf War illness. It didn't meet that goal ultimately yet, but certainly the research has been very promising, and there are some treatments that have advanced to phase 3 clinical trials. Unfortunately, the successor program, the Toxic Exposure Research Program, is profoundly underfunded. And we were funded for the Gulf War Illness Research Program at $25 million, which sounds like a lot of money until you're a researcher and you find that your study is $1 million or $3 million or $6 million to do what it takes. And those aren't even huge numbers compared to what a big pharmaceutical company is going to expend perhaps $1 billion or more to bring one drug to market. That's going to hopefully make a difference in improving, continuing life, extending lifespan, or improving symptoms. There have been many other successes, all the lessons learned through hard-won federally funded medical research that have narrowed the search for treatments and advanced some now to phase 3 clinical trials. All the many research publications and peer-reviewed medical journals, scientists who have built their careers on advancing this and are now well positioned as mid-career and senior career scientists and researchers who are well positioned within their fields to take this to they're highly credible, and are many of you who are speaking today are taking this to higher levels within the scientific community. The many conference presentations, specific conferences focused on Gulf War illness, the collective advancement of human knowledge in these areas that will never be lost. It's now in peer-reviewed medical publications. And then for the benefits for those veterans who can no longer work, the successes are certainly clear as well. There are benefits available for undiagnosed illness, for chronic multi-symptom illnesses like fibromyalgia and irritable bowel syndrome and functional gastrointestinal disorders, chronic fatigue syndrome, or myalgic encephalitis. And then certainly not to forget the Honoring Our Pact Act, which I had the privilege of being involved with early on for a couple of years before it became passed, and helping to list the conditions that were ultimately approved. The list never goes far enough. That's how advocacy works. You have to learn to settle for half a loaf when you'd really like the full loaf. But half a loaf is better than nothing. And even if you get just a few crumbs, that's better than nothing. And so take what you can get and never stop fighting and never stop going. Where we are now is a little bit more concerning. Gulf War illness research funding has stagnated, and with it, the hope for treatments and its hope cures and preventions. Those are at risk. The presentations we've heard today are only possible through adequately funded research. I want to say that again for all the veterans who are listening to this, because we're the ones who are affected. But anyone who is in a policy-making role, anyone who is a veteran who's affected, anyone who cares for a veteran or a military service member who is affected by toxic exposure, adverse health outcomes, the presentations we've heard today are only possible through adequately funded research. That only happens by advocacy. None of this happens automatically. Even military pay raises for the troops doesn't happen except for through advocacy of our veteran service organizations and the military organizations that support them. None of this happens automatically. Today's congressionally directed medical research program's toxic exposures research program is underfunded, sadly, and only at the level at which the longstanding Gulf War illness program was to be funded. But its responsibilities for that toxic exposure research program are literally for any toxic exposure imaginable, not just Gulf War illnesses and the Gulf War experience. The members of the panel who are funding those have a hopeless task. How do they sort through the hundreds of studies that are coming through and choose to fund which ones are the best? Well, how do you even decide what's the best when you've got veterans who are affected by all sorts of toxic exposures, not just the Gulf War experience? It's grossly underfunded, and it's a tragedy. Advocacy could help to turn that around as well. Increasing the funding, increasing what specifically the focus areas are, perhaps growing the CDMRP, the broader congressionally directed medical research program, to again have specific types of federal funding, perhaps one for burn pits exposure, or for other types of specific exposures, reinstating the Gulf War Illness Research Program. VA certainly has funding for Gulf War illness research and other toxic exposure research, but it's limited and it's solely for VA researchers. And certainly it's possible for researchers to get affiliated with VA and so on, but that's not for everybody. It's not possible for every researcher. And so that's a limited pot of money, and it's limited in its focus and in its abilities. Certainly, they're doing a far better job than what they were doing 30 years ago, by far. Come a long ways through the professional leadership of key and committed leaders there, Dr. Karen Block and others who are doing a great job. NIH has very limited funding for Gulf War illness, but certainly they're doing at least a little bit. But it's just inadequate as well. And advocacy is what turns all of this around, developing relationships and growing that. And it's something that more than one person can do. Unfortunately, one of the lessons learned as well is that health patients with illness can certainly be good vocal advocates, but we're very limited. I've developed a bone marrow cancer, and my health is very limited as well. It's not unsurprising given my putative mustard gas exposures. It's not unsurprising for a lot of us with toxic exposures. It's now on this new list of conditions for VA claims for disability. It's now a presumptive, but there are a long list of blood and bone marrow cancers that are now presumptives as of just a few weeks ago. VA has certainly done a much better job at connecting all of these and making them presumptive. But for those who are suffering from these conditions, there's very small hope for us, and then certainly for our survivors, when lives are taken far too short. Like so many of the Gulf War leaders that I knew from the 1990s, so many of them are gone now. Where we are going, advocacy needs to continue, and it needs to be taken up by a new generation. And certainly researchers who are directly affected and people in your labs can take this up. Those who are affiliated with universities have federal advocacy arms within your universities that can take this on as well. Those of us who are experienced with this can certainly give advice. I remain willing and available to provide that kind of advice and consultation. I'm simply no longer able to travel like I used to travel 20 times a year to Capitol Hill. And my entire life was focused on being in Washington and preparing for going to Washington and recovering health-wise from being in Washington and going back and doing it again, and others like me. But the advocacy needs to continue, and people like Denise lobbying literally going to every House office in one of the years and continuing, and just, champions out there just continuing this kind of thing. But we need lots of voices out there as well, and someone or some people to take a leadership role. And those who are like me, who are now to the retirement stage of advocacy, can certainly advise and assist and give guidance, but it needs to be taken on by an entire generation of those who are affected, and ideally by those who are healthy. A wonderful friend and key advocate leads Burn Pits 360, and Rosie from Burn Pits 360 is just a phenomenal advocate, but she's also healthy, advocating for her husband. And that really has helped an awful lot, because it's awfully hard when those of us who are sick are doing the advocacy ourselves. So Dr. Klimas, Nancy, you'd mentioned that it would be great to capture my perspective, some of the smoke and mirrors we managed to get through, the backing of Congress, and the big message that there is no progress without advocacy. And I can't emphasize that enough. Without adequately funded research, none of this is possible. And health doesn't happen by itself. It only happens through medical research, and medical research only happens through funding, and funding only happens through advocacy. I'm happy to answer any questions that anyone might have now, or my email is very simple. It's just a little long. It's Anthony, ANTHONY, at veteransforcommonsense.org. Veterans with an S, the word for spelled FOR, commonsense.org. The website is Veterans for Common Sense. That's my national organization I continue to lead in a mostly retired way at this point, but support where we can. my deep sense of necessity regarding advocacy to provide a path for scientific progress. I can't emphasize that enough. And so I'm happy to answer any questions that you may have now or in the future, including via email. And very honored to have this opportunity today. And thank you to every one of you that's participating in this conference for the research that you're doing that's trying to make a difference in the lives of our veterans exposed, impacted by toxic wounds, as I prefer to call them. Toxic exposures is what, is a little different than the toxic wounds that we're experiencing. And simply just a thank you to all of you as you continue. That's all. Thank you.
Annie, that was such a good recap of a whole life's work. Thank you. And thank you from all of us, veterans, and from the investigators and the clinicians that care for all the veterans of the Gulf War. I'd like to describe something that happened at one of the conferences. I think you were there. It was one of our SHIELD conferences in Fort Lauderdale, when there was a panel of advocates. And one of the advocates turned to the audience and said, knowing what you know and how your life has gone since this Gulf War, if you had to do it all again, would you still volunteer to go to the Gulf? And every woman and man in that audience stood up and said yes. Yeah. It's one of the few times I've been brought to tears in public around the Gulf War. I was so moved by that experience, and I think that this passion that you've brought has been so important. For those of you that are still with us, we actually asked Anthony to do something else today. We sent him a box, and I don't know if you've ever seen an unboxing, but he's going to unbox the box for us. It's sort of a surprise. And
so I'm opening the box now. And thank you. So I don't know if you can see, I'm unboxing this. I'm going to move this back just a little bit.
Yeah, we can see you got the edge of the box on there. We're good.
Okay.
Bubble wrap. More bubble wrap.
And there's a box within the box.
There's a box in the box. This is good. Let's hope there's something inside the box. I've been fooled before.
Well, it feels weighty enough that it's not just bubble wrap. So, all right, let's see if I can figure out how to open this. It looks like it's a wrapper on the box. So I'm unwrapping the box. Okay. And inside.
Oh, there's stuff. And there should be something pretty inside. There you go. Yay.
Well, this is just beautiful.
Wow.
Very heavy.
Can you read that? Are you able to read it?
So on the top, there's a logo, and it's Operation Desert Storm, Operation Desert Shield, Saudi Arabia. The logo across the top, and then it says, "Thank you, Anthony Hardie, Lifetime Achievement Award on behalf of the veterans of Operation Desert Shield, Desert Storm 2025. This is very moving. Thank you.
Oh, Anthony, no one deserves this more than you, and you representing, many people, but you in your personal life's work, you deserve this and so much more. We've had so many testimonials, and it's a beautiful thing how you've touched so many lives with all of your efforts. But I thought it was a lovely way to close this year's conference because I asked you to give that talk about your experience. We need that now, and what you have done. If that energizes, even, I know it's hard to energize someone who's so sick in our world, but of folks with Gulf War illness, but if it brings more people to the front to speak to and advocate on behalf of veterans, your words are so powerful, but your actions so much more powerful. So thank you.
Well, thank you very much. And if I could say one or two sentences at the end of that, and thank you. We do it for each other. And when you ask those who would serve, if they would serve again, we served alongside men and women who came from every walk of life to take on an incredible challenge at risk of life and limb. And what we didn't realize was also our lifetime of health as well. And would we do it again? I would certainly do it again. I think every one of us would do it again, as you've heard before. And we do it for each other. But advocacy is the same. We do it for each other and for current and future generations. And so I certainly hope that others will rise to the challenge and take up your challenge. And I give the same challenge. And thank you so much for this. This means a great deal. And it's an honor to have served and to continue to serve my fellow veterans. And I hope that others will continue to follow. And thank you yet again. I'm humbled and honored.
As we all are in together, trying to find the answers that everyone needs and to save the generations of future veterans from harm's way if we can find ways to prevent and keep everyone's health despite all these terrible exposures that we can't sometimes even predict. So on that note, unless there's any other folks here that want to speak up right now, you can if you want. I'm going to close the conference, the 2025 conference. You'll see us back again next year on and about this date because it's a momentous date. And next year will be that'll be 35 years next year. Yeah. Anyway, it's a lot. So thank you, everyone. First, thank you, speakers. Thank you, participants. Thank you, veterans. And thank you to the team at NOVA that put this all together. Thanks to the whole team at NOVA. Remember, of course, that we are also using this to try to recruit and get people to participate in studies. You've seen in the chat all kinds of links, but any problem, just go to the Institute for Neuro-Immune Medicine's website at NOVA with Gulf War illness. You'll see there's the button right there. You can register and we'll send you all kinds of information about ongoing studies. And if anyone's an investigator and you want us to use that link to send out information, we do it all the time. We'd be happy to send out information to the people in the registry about the studies that you're trying to recruit. So thank you so very much. Have a wonderful day. And Anthony, we love you. Thank you.